In 2024, the HIPAA Journal reported a staggering 63.5% increase in healthcare data breaches. That's a jump from 168 million leaked medical records to 275 million in just 1 year. If you think cybercriminals are slowing down, think again. These attacks aren't going away, which is why every healthcare organization, no matter the size, needs to understand and comply with the Health Insurance Portability and Accountability Act. HIPAA was issued by the U.S. Department of Health and Human Services to protect sensitive patient data. This includes protected health information, or PHI, anything that can link health data back to a specific individual. That could mean lab results, insurance numbers, diagnosis codes, even something as simple as a date of birth. And because this data is so valuable, it's one of the top targets for cybercrime, which makes airtight security protocols and regular HIPAA training not just helpful, but absolutely essential. Now let's talk about risk assessments. HIPAA actually requires covered entities to evaluate their security measures under two separate provisions: the HIPAA Security Rule and the HIPAA Breach Notification Rule. These assessments help uncover vulnerabilities in your system, policies, and even employee behavior. But there are three main types of HIPAA risk assessments: a security risk assessment, a breach risk assessment, and a privacy risk assessment. And while security tends to get the most attention, privacy assessments are just as critical, especially in environments with a lot of human interaction. Think about the front desk at a clinic, a call center handling patient records, or even a billing department. It only takes one overheard phone call or missed file document to trigger a violation. So what is a HIPAA privacy risk assessment? It's a process that helps you evaluate where PHI might be improperly accessed, shared, or disclosed. The goal is to identify weak points in your organization's privacy practices and improve them before an auditor or hacker does. And yes, it applies to everyone handling PHI. That includes healthcare providers, administrators, vendors, business associates, and subcontractors. If you store, access, or transmit patient data, you need to perform a risk assessment. It's not optional. When you fail to meet HIPAA compliance, you open the door to serious consequences. We're talking fines, audits, damaged reputations, and even legal penalties. And none of that requires criminal intent. Accidental disclosure due to negligence still counts. So how do you actually conduct a HIPAA risk analysis? Start by defining the scope. Look at where PHI enters and flows throughout your organization. Who handles it? Where is it stored? What systems, devices, or platforms are involved? Designate a privacy officer, someone responsible for mapping out the flow of PHI, identifying who has access, and examining how the data is transmitted internally and externally. That person should review existing policies, conduct staff interviews, and analyze workflows for potential weak points. From there, you'll need to evaluate risk levels by measuring both likelihood and impact. A common method is using a scale from 1 to 5, 1 being the least severe and the least likely, and 5 representing extremely high risk and very likely. Once you have these levels mapped out, you can prioritize threats based on which ones pose the biggest danger to your operations or patient privacy. Document every part of this process and revisit your risk assessment regularly. Ideally once a year or anytime you make a change in technology or processes. The Office for Civil Rights and the Office of the National Coordinator for Health Information Technology offer a free HIPAA security risk assessment tool. It helps healthcare organizations identify and prioritize risk more efficiently. Another great resource is the Health Industry Cybersecurity Practices Framework, also known as HICP. Developed by the U.S. Department of Health and Human Services, it outlines the 5 most common cyber threats facing healthcare today, including phishing, ransomware, and insider threats. HICP matches those threats with 10 actionable best practices, customized by organization size. So whether you're running a small clinic or a large hospital, you can take meaningful steps to protect your data. In today's environment, HIPAA risk assessments are non-negotiable. The rise in data breaches means the Office for Civil Rights is busier than ever, and with more investigations comes a higher chance of penalties for any organization that isn't prepared. If you'd like to learn more about HIPAA risk assessments, reach out to K2GRC, and you already made it this far into the video, so you might as well like it, share it, and comment below.